Good morning, everyone, to the Wednesday, December 8th media briefing by the Windsor-Essex County Health Unit. Today, we'll start with a few remarks from our CEO, Nicole Dupree, and then we will go right into media questions. Nicole, after you.
Great, thanks. Yeah, we just wanted to start off with clarifying a few questions that we've received. So we have been getting questions about text messaging and whether or not those text messages are coming from the health unit. So I just wanted to clarify for the public that we are using a system. It is a system across all public health units within the province called a virtual assistant. So the system is being used in order to support efficiency in completing our investigation calls and expand our outreach capacity for collecting key information to prioritize and plan additional outreach when we have cases identified. So really what we do is individuals who are positive may receive a text message from us if they consent to, it's called the virtual assistant. If they consent to move forward, they'll provide just some information for us that kind of is helpful to get our investigation started, and it allows us to get information quicker for follow-up. So when they get this secure link, they'll click on the link, they'll receive a form, and it has important instructions related to isolation, and ask just again a few sort of basic questions to help us to get started, so that when we do follow up with the individual, we have some information already to start with. So we just wanted to clarify that those that do receive those messages can be assured that they are legitimate links, and they are they are coming from us. So if you're an individual who has tested positive, you've received your result, and you've received a secure link via text, you could be assured that it is us reaching out. As well, I'll just clarify one other point. We are receiving a lot of calls. There is some confusion related to the 50 plus. So there was an announcement by the province recently that soon there will be a new eligible population. So those individuals who are 50 plus are eligible to book as of December 13th. I know we've received some calls. People have gone to the booking site and are unsure or unclear as to why they're not eligible. And it's just that the eligibility for 50 plus is officially December 13th. So we are working with our booking center, our calling center, as well as our online portal. And as we start to put dates up for next week, we will open the site for individuals to be able to book from the 13th on who are now newly eligible. And that's it. I'll take questions.
Thank you, Nicole. Today we'll start with the Windsor Star.
Yes, good morning to you both. I'm wondering if you have any updates on the outbreak related to the social gathering at the restaurant in Kingsville.
Well, we're continuing to investigate the outbreak. The key public health issue is that we already know that there are 40, I think at the current time, there are 42 people who attended that social gathering or are affiliated with the social gathering who have tested positive. Our public health goal and our community goal is to try to prevent any further spread beyond those 42 people, particularly to other enterprises, institutions, homes, residences of migrant farm workers, otherwise commonly called bunkhouses, and that's our goal at this point in time. I think we'll have a more fulsome analysis of all the data as the days progress, as we have recommended testing for a large number of people affiliated with the enterprise. And as we have more information, we'll be in a better position to comment.
Thank you for that. I'm wondering if you have determined yet whether or not the involved business did check proof of a vaccination for the attendees.
Yeah, maybe I'll ask Nicole to comment on that first because she manages the operations, and I could supplement that as well.
So again, this is all of those elements. Whenever as part of any outbreak investigation related to a workplace, we're going to look through all of the requirements and protocols and ensure that what is necessary to be in place is in place. They were checking verification, and but we are still, you know, it is still a part of our investigation. It is still being investigated.
Yeah, if I could supplement that, I think it's important to at least highlight, and I think we all recognize this, the Public Health Service tries to work without judgment. Our goal, for the most part, is it's to focus on trying to prevent the transmission of illness and the burden of illness in the community. Without speaking of any one event, outbreaks of this nature usually have many factors that contribute to its either inception or its spread. And that could include things like individuals who are vaccinated but not effectively vaccinated, people that are potentially unvaccinated, some individuals perhaps not following public health measures, some people not understanding public health measures, some people not self-isolating when they were required to, social distancing that may not have been effectuated at the site of service. So the list is usually quite long, and typically there's not one event that can, or one factor that is primarily responsible. Many times there are many factors that are responsible, and we'll know that as the investigation moves forward. Now, clearly, if there are breaches of public health guidance that are intentional, or then we will consider enforcement actions. But for the most part, the Public Health Service works without judgment, and we've always worked on that, worked in that framework.
Thank you.
Sorry, I was muted there. Any questions from AM 800?
Nicole, just going off those questions. So, for example, if an individual showed, I guess, a fake vaccine proof of vaccine proof, could that individual be, I guess, charged or fined? And then if, I guess, the restaurant didn't look at it, or I'm not sure how it works because it's probably hard for a restaurant to tell if it's a fake, could the restaurant also be charged or fined?
So, you know, if someone has a fraudulent vaccine record, we don't have the authority to charge for that, nor are we the experts in fraud. And would we be able to verify, you know, those kinds of details? I'm not sure. I think what we look for is that a business is following the guidance, the recommendations that they are checking. You know, we would defer to the proper authorities to investigate any kind of fraud, which would be the police.
Okay, thank you. Doctor, just in regards to the new restrictions that go into place this Friday, a lot of questions out there in the community, it seems like, since Sunday. Don't want to use, I guess, names, but obviously they're well-known facilities in our city. For example, WFCU Center, then you have Caesars. So are those facilities, there's no restriction in place for those facilities? So if I want to go watch a hockey game, or if I want to go see a show at Caesars, I can be in there with, for example, thousands of people?
Well, there are, the province has promulgated rules and directions as it relates to a number of organizations, institutions, and enterprises. Those directions are requirements, and they should be followed. Every person has also been given guidance about how to minimize the transmission of COVID-19, and I think all those, all individuals who should follow those, follow that guidance. The public health letter of instruction is an additional layer of protection based on the burden of disease in Windsor-Essex and the historical disproportionate impact of COVID-19 on this health district. There are always going to be some apparent inconsistencies in the framework, and we accept that. And part of this is also individual assessment of risk and responsibility. It is true that the letter of instruction doesn't provide additional restrictions on certain events, but that doesn't preclude people from using their best judgment on if they want to attend an event and how they want to attend it. And so I would ask people to follow the guidance of the province and the direction of the province, follow the direction of the letter of instruction, and also make their own individual assessment of risk. If you go to a large athletic event and you contract COVID, that also means that you inconvenience your family, and you'd have to consider that risk-benefit decision in making those decisions. I'd close with this. Fundamentally, we all recognize, I think, public health service and in the broader community, that these restrictions are disruptive, and it's disruptive around Christmas time and the holidays, and they've caused immense inconvenience. But that has to be balanced, like everything else in a family or in a community. It has to be balanced with the fact that 475 people died of COVID in Windsor-Essex. That's more people than you might expect in a season of car crashes. I think approximately 700 cohorts of children have been dismissed. School time disrupted, and recognizing that there may only be 180 school days a year, missing 5, 6, 7 days of school is a serious disruption. So at the end of the day, the balancing act is about, what level of disruptions do we think are reasonable to try to keep the most important things functional. And in my mind, if in a household, it's more important for a child to go to school than for a parent to have a Christmas party. It's probably more important for young people to continue with their instruction and not be dismissed from school than to have a holiday party with 25 people. So that's the balancing act that we have to try to maintain at the public health service. And in the broader community, if we want to bring COVID under control. The other issue is that the hospitals have already stated that their resources are stretched. The more people that actually acquire COVID, the more people that are going to go to the hospital, the more people are going to be admitted, the more people are going to go to the ICU, and the more people who will die. And what we don't want is to saturate hospital resources during this holiday period. So that is one additional reason for putting forth this letter of instruction. Sorry for that long-winded response. My apologies.
I guess since the letter of instruction was issued Sunday afternoon, how has it been received by the health unit? Nicole, a lot of questions, maybe backlash. How has it been received?
We've certainly received a lot of questions, appropriate, in clarification and, businesses and individuals seeking to understand how it applies to them and how it does not. Like anything, there's a lot of questions around, well, why this and not that venue? And I think, your earlier question certainly, I think is alluding to that. I will say, it is difficult. We review every day as a team within the health unit. We are monitoring. We have, well over 500 active cases, up to 4,000 contacts that we're managing, and we do review our data and every day, and we discuss and we look at the scenario. And when significant decisions like this are put in place, the intent certainly is to lower the amount of COVID-19 transmission within the community, and we are looking at the information that we have and making those decisions based on where the highest risk for transmission is and where we're seeing activity and transmission. And I think keep for individuals who are seeking to understand. My best recommendation would be to ensure that you're working with the facts and keep calling us, and we're open always to respectful dialogue and answering questions, and we'll do our best to I guess share information in a way that is helps people to understand.
And sorry, one final. Sorry, go ahead.
Is it okay if it's okay to supplement this? The way the public health service in Windsor-Essex is currently functioning is exactly how the legislature, the people envisioned when they put forth the Health Protection and Promotion Act. Because the legislature envisioned, and it after SARS, and even before SARS, that many of the decisions that have to be made on the best possible public health guidance based on the local circumstances without political pressure. And so the decisions we make are based on a framework of what the public health service believes is best for the community at this point in time. The second is that our goal is to try to do the very best we can, recognizing that some people, rightly so, will disagree with the management approach, and sometimes only history will tell if the management approach was the right one or the wrong one, or the best possible given the facts and circumstances. In this particular case, we're challenged because we're dealing with a relatively new disease, which is biologically changing, as you can see with the Omicron variant. The final thing is I receive a lot of calls over these past 2 years from people who are supportive of public health measures and are afraid and are concerned for themselves and their families. I have had individuals who publicly say that they're opposed to certain public health measures, but when asked, well, what does that mean for you and your family? They're very supportive of it. So, and so I think that's the challenge is that we all recognize this is a difficult situation. At the end of the day, the public health service is not governed by polls or popularity. Our decisions have to be the best possible decisions that we can make at any given time based on the facts and circumstances. And so long as the statute requires that, that's what we'll do moving forward.
Sorry, and just one quick one here, Doctor. I know I asked a similar question on Monday about this in regards to the timeline. So obviously the new restrictions go into place this Friday. Usually it's about the 2-week window, so that would be Christmas Eve. I know there's a lot of discussion in the community about how do we plan for the holidays. Can you come out and say that these restrictions will be in place, I guess, all the way up until the new year, or is that tough to say? Because obviously, like you mentioned on Monday, you want to look at the data.
Well, we always look at the data, and as doctors, we are reluctant to predict the future. With COVID-19, to see the effect of any public health measure, you really have to wait at least 2 weeks. So the effect, if the direction is implemented this Friday, it'll be 2 weeks from that day before we'll know if there's any substantive impact of these measures. That's the first possible time that we can make those sort of determinations. We'll look at the data, we'll look and see how things are going, and then if modifications need to be made, that can be done. That being said, I would plan that if you are having a social gathering, to have it to less than 10 people. And it's just not because it's public health direction, it's also the right thing to do. You know, many times when people meet for Christmas dinner or Christmas Eve dinner, or have a gathering with colleagues, some of the people at those events are elderly, and a COVID case in a young person can mean illness, but in an elderly person it could mean hospitalization and death. So I think that every person should consider what the consequences of having a holiday party are in the context of COVID-19, and keep the numbers to less than to 10 or less.
Thank you.
Any questions from CTV?
Yes, good morning. Just looking for clarification. What was the exact date of the Kingsville restaurant party that led to the outbreak?
Yeah, if I could answer this in a more fulsome way, the issue is not the date of the party. The issue is about when there was a chance of exposure to people who might have contracted COVID. And without speaking to the specifics of this event, one can become infectious or one is believed to be infectious 2 days before you have the onset of symptoms. So if there is an exposure, there's a look back period to 2 days under the current public health guidance. And that's why the date of event is not always concordant with the date of risk. And so the dates, I think November 18th to December 2nd, I think was the window that was provided for this exposure. And so I'd prefer, we are, as challenging as it is, we try our very best to protect the privacy of the people we serve. And so that's generically why there can be a discordance between a date of event and a date of exposure.
So you're not releasing the exact date of the event then? We're just to say that November 18th was the date of exposure, or date of exposure over the 2 weeks.
Well, I think, look, we work with a lot of sensitive information, and we, at the Public Health Service, we're reluctant to identify or single out any person, enterprise, unless it serves an important public health goal. So I would prefer that the Public Health Service just share the dates of exposure. Perhaps Nicole can supplement this, but I don't believe the Public Health Service has shared the date of event.
Yeah, I mean, I would just say, I think from our perspective, the important dates are those dates that we have shared, which are the dates of exposure. And for us, it's about communicating out to the public and anyone who might have attended that venue to self-monitor, and get tested. And so, all of the dates that we've put out there are important rather than the specific date of the event.
Okay, sounds good. From yesterday's daily report, there were 4 deaths. I know we've asked this before, but is there any way you can release the vaccination status of the people who died?
So we do provide vaccination status in our weekly summaries, but we really, again, aren't going to provide additional details about a single individual. But you can certainly, we provide around our cases on a weekly basis, the percentage of those cases that are vaccinated versus unvaccinated.
Okay. Does the health unit acknowledge that COVID is an airborne virus? I know there's been a lot of discussion over this over the course of the pandemic.
Well, in medicine, it's the word acknowledge is not typically how we characterize disease. These are, we can talk privately or we can talk at length about the academic issues about this. But the distinction between airborne and non-airborne illness is arbitrary from a clinical point of view. We could share with you what we think we currently know is that we think that COVID is transmitted by respiratory particles. I think that's pretty clear. The closer you are to somebody, the more the higher the risk of you transmitting the illness to somebody else. We use 2 meters as a framework, but respiratory particles can travel further or less depending on a whole variety of factors, which aren't which are still, I think, trying to get some understanding from. Do I think airborne transmission from an epidemiological point of view is a substantive cause of transmission? I don't think the evidence suggests that at this time. That might change as time moves forward. And it doesn't really change what our clinical management is today, which is that the public health measures that we're doing today, we believe are likely, the evidence suggests more than likely, to contain COVID-19 and contain transmission.
Thank you. And what do you think?
I'm sorry, Melanie. We're actually pressed for time today. So
Okay.
Any further questions, I apologize to the group. Just forward them to me and then we'll pick up tomorrow at our next media briefing. Sorry about that. I didn't realize that we were pressed for time today.
No problem. I will.
All right. All the best.
Thanks.
Thank you.
Bye-bye.
Thank you.